started doing pelvic procedures with the robot after the robot's been introduced in Mediclinic Durbanville since 2013, and it's been used by the urologist to do mostly prostate surgery. Pelvic floor procedures means prolapse in females, either rectal or vaginal prolapse, and then rectal cancer patients we want to help with the robot. The advantages of the robotic instruments are that we can reach low down into the pelvis, where the laparoscope has got straight instruments and we can't negotiate the curvature of the pelvis.
I previously had pelvic floor surgery 2 years ago, of which was unsuccessful. I had a bladder repair done after that, which was lifted, which was very successful, but I opted to wait a bit before I went back to have the pelvic floor repair done. So I came to see Dr. Rademan January this year. He was aware of my problem and he organized someone to do an ultrasound of me in his rooms, and once he got all the results I went back to see him and we discussed what was going to be done. He then suggested I'll wait for the procedure to be done on the Vinci. He was going across for training and he was booking a period of time in June, and then he would like to do the surgery on me then.
Each exercise you need to complete with an average of above 90% for that exercise. Points are deducted, for example, if your instruments move out of view, if you have too much movement on the inside, meaning you move around without doing the proper exercise as they want. Time-wise, I usually want you to do 20 hours plus. Me and my colleague did, I think, 3 times that to train ourselves and make sure we are well trained. Then you fly to a laboratory where you operate on tissue, and we went to Belgium, and you have a 2-day training on positioning the robot, putting it safely on, taking it off again, and make sure that you know every step before you start on a patient.
Everything was extremely well explained to me, and I think everyone was quite excited. So everyone was willing to share so much with the person, and that made it easier and more comfortable for me as well. Apprehensive, as we all are for surgery, but at least I knew what I was in for.
With robotic surgery you can do specific, precise millimeter by millimeter surgery, because the robot machine takes that tremor away. The camera is controlled by the robot itself, and there's a 10 times magnification on the view. Where the robot's got an arm in the front like your wrist, and it can move 360 or more than 360 degrees. So if you go down into the pelvis, you can turn the instruments up and work upwards and have an upwards motion and put stitches in or cut or remove tissue as you wish to do.
I feel absolutely wonderful, and I'm still continuing on my feet and walking with my dog and in the garden, and I'm so grateful. Doctor said to me, let's wait for the Da Vinci, let me get trained, and we do when I'm ready to have it done. It's awesome, and I must also just thank the hospital staff as well. They were fantastic, and the surgeons, they're also part of the journey I've had.
For the patient, there are lots of benefits. They are up and out of bed much faster because there's less tissue damage. They eat much faster than with traditional surgery. Their bowel function comes back much faster, and they are discharged from hospital much faster, meaning that they get back to their normal lives and works much faster.
I think one of the most exciting things about having this procedure done now and being so successful is getting back to the lifestyle that I used to enjoy, which was spinning, just casual running, trail runs, which is something I've always enjoyed, but for 2 years I have not been able to do it. And I think I'll be soon back on my feet and on the bicycle, enjoying myself again and leading the lifestyle I was accustomed to.